My name is Tamron Schmoll, and I am a certified birth doula and hypnobirthing childbirth educator. So today I'm going to be answering a question that every doula has probably been asked at some point, and that is, what is the difference between a doula and a midwife? Do you need one? Do you need both? Who do you choose? So in answering this question, I often jokingly tell people that the simple answer to this is that a doula cares for you from the waist up and a midwife cares for you from the waist down. So we actually work really well as a team. But let's take a more serious look at the difference between these two birth professionals, as well as the differing roles they play, and when you would choose to use which one. So when you're pregnant, you will need a medical care provider who will provide prenatal care throughout your pregnancy, attend your birth, and provide postpartum medical care. Such a care provider is basically responsible for looking after the physical health and well-being of both you and your baby. Depending on where you're birthing and your level of risk, you'll either see a midwife or an obstetrician for your regular checkups and the birth. If you have a high-risk pregnancy and expect complications, complicated birth, or need a cesarean, then your primary care provider would be an obstetrician. They are specialist physicians who are trained to deal with the pathologies of pregnancy and birth, and you would then give birth in a hospital setting. In this case, you will be cared for during labor by the staff midwives and nurses of the hospital, and your doctor will usually only arrive when the birth is imminent. However, if you have a healthy, low-risk pregnancy and you desire a natural childbirth, then you can have a private midwife as your primary medical care provider, and you can then give birth at a hospital, a birth center, or even at home. Midwives are the experts in natural birth. They believe that birth is a natural physiological process, but they do also work with the support of backup obstetricians who can assist with any emergencies. For example, if you need assistance or a cesarean. Many midwives function from a more holistic standpoint, so they will often provide you with more personal service. Certainly, they'll be with you for a longer period of time during your labor than a gynae would, but they also need to focus on your baby's health throughout the process because at the end of the day, they are your medical care provider. They are the ones who will be checking your cervical progress, taking your blood pressure, checking baby's heartbeats, basically carrying out all of the other medical checks and tests that are needed during the birthing process. So this means you will be in good hands, medically speaking, whether you're birthing with a midwife or a gynae. But you'll possibly lack the presence of a continual support person who doesn't focus on the medical side of things, but who rather focuses on your emotional and physical comfort. And this is where a doula comes in. A doula is a non-medical professional birth companion who has been trained to provide emotional, educational, and physical support to parents during pregnancy, labor, birth, and postpartum. So you don't choose between a doula and a midwife or obstetrician, but you rather hire a doula in addition to your medical care provider, so as to enhance your birthing experience. Thanks to the evidence on doulas, some medical aids are even paying towards our fees. According to the research, which prompted the medical aids to pay for this, the presence of a doula is shown to increase the chance of a spontaneous vaginal birth, shorten length of labor, decrease the need for cesarean birth, decrease the use of pain medication, increase baby's APGAR score at 5 minutes, and increase positive feelings about the childbirth experience. This actually reminds me of a study by Penny Simpkins, during which she asked mothers about their childbirth experiences some 15 to 20 years afterwards, and all of the mothers reported vivid and deeply felt memories that depended not so much on their actual birth outcomes, but rather on how they were treated by those around them and how in control and confident they felt. So your emotional well-being is super important to your doula. Her continual calm presence reduces your anxiety and increases your confidence in your power and ability to give birth and look after your newborn baby. She's with you every step of the way, and she reduces your fears and reminds you of your inner strengths. She can take pressure off of your partner, and she'll often serve as a buffer for the intensity that can come with labor, birth, and the early days as a new family. One important thing you must know about a doula is that you can never offend us. There's next to nothing we have not seen or heard. We are there to support you through the roller coaster of emotions that you face, from tears of joy to confusion over what your body is doing, to the anxiety of preparing to welcome a new little human into your life. Thanks to her knowledge, experience, and training, a doula is able to give you evidence-based advice to help you navigate this parenting adventure. She'll develop a relationship with you and your partner throughout pregnancy by doing prenatal visits with you and via electronic communication, and she can assist you with a variety of things. For example, she might help you with what to expect during pregnancy, refer you to care providers who share your philosophy on birth, prepare you and your partner to cope with labor and birth by sharing various useful techniques and information, guiding you in drawing up a birth plan, giving you a packing list for your birth bags, letting you in on what happens during your postpartum recovery, and she can even teach you some general newborn care. She will prepare you and your partner for the labor, birth, and postpartum experience that you envision and deserve. And if she's ever unable to help you with a specific challenge or information herself, she will immediately refer you to the right professional. She will help you make decisions that are in your and your baby's best interests, and she will always support you and your choices, no matter what. Because she knows that what one needs most during childbirth and early parenting is unconditional and unbiased support and care. So your doula is like your best friend during the birthing journey. She's the one you contact when you don't know who else to talk to. Many doulas also provide complementary services. For example, specialized antenatal courses like hypnobirthing, like what I do, or other therapies like reflexology or aromatherapy. Moving on to physical support that your doula might provide, it's mostly seen during labor and birth. It could include some well-positioned counter pressure, a few soft words of encouragement, rebozo sifting, dabbing lip balm on your lips, suggesting a new position, offering you water while your partner catches a quick nap, a gentle massage, helping you to breathe, coaching you through that, helping you clean up after birth, and guiding you during that golden hour, helping you to establish breastfeeding. The ways in which a doula assists you physically are nearly endless and will look completely different for every parent. She'll show your partner how best to support you and will provide them with the opportunity to be fully present with you as you bring your baby into the world and care for them in the early days, so that you don't have to worry about all the practical little things like reminding you to empty your bladder or putting out the candles. The main aim of the physical support of your doula is to ensure your utmost comfort, no matter how that may look. Perhaps your baby has chosen to be born earlier than expected and you realize you need some last-minute essentials from the shop. You guessed it. Your doula is going to get in a car and go and get them for you, or she'll stay with you while your partner goes. She's usually a mom herself, and she knows what is really essential. I hope this talk has cleared up the differences between a doula and a midwife, and I would love to answer any questions you may have about labor, birth, and doula support.